Thank you so much, Rina, for the deep introduction. A very good afternoon to everyone. Good afternoon. Yeah. Um, Thank you so much again to the organizer for inviting me, and of course for giving us this space to talk about transgender issue from the HIV/AIDS perspective. So thank you so much, the organizer. Before I want to start with my presentation relating with HIV/AIDS, first and foremost, which I always practice is I like to educate about what is transgender, because most of the time people are so unaware and they get confused, even with the terms of LGBT itself, lesbian, gay, what's B? Come on. Bi, T, I. We can go on, IQB and so on, right? Yeah. So, first of all, we need to understand the T in the LGBT definition, right? And people are so into the binary system that they get so boxed up that men have to be certain ways and women have to be certain ways, that eventually puts us trans people out of this health perspective. And that will affect even the health programs or health prevention programs in, I believe, in every state here, right? And in Malaysia, we have health prevention programs for MSM and TG. Way back then, it's just MSM, and the transgender people are always being placed under the MS. You know what's MSM, right? Anyone? Yes. Are you guys sleepy? Yeah, I understand. Just after your lunch and everything, right? So we used to be parked under the MSM population, and at the end of the day, we are not trying to say that we want segregation, but what I want to say is that our issue, needs, and concerns of the transgender community is different from the LGBT community itself, okay? So the first thing we need to learn is when you talk about sex, about biological sex, it comprises of a person's genetic makeup and often called as a birth sex or assigned sex at birth, right? And this is the thing that where often doctors, when you see a baby comes out and you have birdie, congratulations, you have a baby boy, and that's the assigned birth had been given to the boy. But as the boy grows up, that baby tend to change to the opposite gender, and where do this person fit, right? So when we talk about gender, the perception of a person's sex of a part of society as being male, female, or woman, right? And that is to differ in certain culture and races, right? And we talk about gender identity. This is the thing that I want to emphasize. A person's internal sense of whether you're being a man or a woman. It has nothing to do with your biological sex or even your gender. Gender identity is between your ears. It has nothing to do with your genitalia or your sex organ or your assigned sex when you're being birthed, right? And you talk about gender expression, it's how a person basically behave in public, whether it's based on their attire, the way they talk, the way they walk, and everything. And it differs again in certain culture and race in the whole world, I would say, right? And there are also people with gender variance or non-conformative, which is their expression or gender roles are from the conventional norms of the society. Again, conventional norms of society, when you have this binary, man is supposed to sit with their legs open. Are all men open? And women are supposed to sit with their legs all closed. Please close your legs, okay? So these are all binary systems being created by the social construct, which eventually affect people who are born different from other people, right? So that one thing you got to understand that when you talk about LGBT itself, LGB, it's more about a sexual preference or sexual identity or even expression of a person. When we talk about T, it's about our gender identity. It's two different things that we need to think about. And because of that matter itself, our issue, I repeat again, our issue, needs, and concerns is totally different from the other cisgender community, whether it's gay man, cisgender woman, and so on, right? And yeah, as I mentioned earlier on, gender is between your ears, not between your legs, darling, okay? And within that gender identity self, we have transgender women who identify as being woman, cisgender woman. Anyone know what cisgender woman? Why so quiet, huh? Okay. It's very simple. We don't use the word transgender and you are normal woman. Again, being doctor, being health providers, we need to be sensitive towards the community. So we use the word as being cisgender and transgender woman. So cisgender women are people being biologically born as being women. Or simply say that cisgender women are not transgender women, right? So we have cisgender men, we have also intersex people, and also gender fluid people, which is combination of male and female or do not want to be associated with any of this gender, okay? So as I mentioned earlier, you guys can go, can read through, but at the same time, I want to mention one particular matter. The transgender term itself. Let me ask you guys, who gave us this term? Us? No. It's the cisgender people. And the term itself was given by health providers, health professionals. But in this term itself, the transgender, it's an umbrella word. And it comprises of other groups of community. We have the transsexual, we have the transvestites, we have the cross-dressers, and so on, that has different gender identity, expression, and sexuality. And this is something that people often get confused. Called maknya, right? Which is for trans women. And because in Malaysia, we even have the Indian society and the Chinese society. So we have the term maknya, we have the term tirunangai. But again, most of the time, the degrading terms are often being used. Pondan, bapo, and so on. Over in Thailand, what is the degrading term? Is it ladyboy? Is it the degrading term? Yeah, because I find ladyboy is always associated with sex work, right? So we need to learn about being sensitive towards the community that we want to include a part of the HIV/AIDS work, right? And it's very simple. As you can see, it's just a reflection of who we see ourselves. We may be born in a different body, but our mind sees differently, right? And if you look at this cute little gender bear, right? It was created by us from Justice for Sisters. We just want to simplify it, that your gender identity is not binary, it's a spectrum, right? People need to think out of the box, so we need to start from today, right? So at the same time, your orientation, it can be either way. And when you talk about sex, it's down here, it's not here. Stop using your brains down there. Our brains is here. And that's why I keep on emphasizing identity is not based on your genitalia. And that's the main problem that I always see when it comes to health providers. Not everyone, yeah? But in my activism work, people are always still stuck in that binary system, right? And now let me start with the main topic why I'm here. The situation of transgender people, right? In most countries, we are not legally recognized. Like in Malaysia, for instance, we are not allowed to change our gender marker. Even our name, we're not allowed to change. But you guys know, before 1982, sex reassignment surgery was given for free in Malaysia. And it was done by health providers, by Muslim health providers, Professor Dr. Khairuddin. And at that time, trans people were able to live as like everyone. We were given our rights for our health, employment, education, and we are able to be a part of the society. However, in 1982, when we have the Sharia law or Islamization came in Malaysia, things started to change. And all of a sudden, they banned everything. And we become the victim of being said that we are being deviant or we are going against religion. So, but this still happens in few other countries all around the world where we have no access to our recognition of our gender identity, right? And being trans is a part of a rich diversity of human nature. Why I mention this? If you look at the history, again Malaysia, because I'm from Malaysia. You look at the history of Malaysia, we have the Sida. Sida is basically people that doesn't because at that time, when we have the king and the queen and so on at that era, right, they don't understand what is transgender. So they call them as Sida, where this effeminate men that will be circumcised, not circumcised, so that will be, what do you call that? Where they'll be castrated, right? And they will be living among the queens in the palace. So we exist in the system, and not just that. In one of the rural states in Malaysia, which is the most Islamic state, which is Kelantan, we used to have the Mak-Yong. Mak-Yong is a dance where you can see men who dress as a woman and dances as a woman. And those people are, way back then, they don't know the term of transgenderism, right? But again, we exist even way back then, right? So some trans people, as I mentioned, they seek gender-affirming procedures, including surgical intervention, but not all trans do that, right? As I mentioned earlier on. And this is very important. Some countries, they even have laws against transgender people. Example, again, my country, Malaysia. I love my country, yeah? But again, we have laws, Sharia laws, which criminalize transgender people. And when I say criminalize, you can be put in prison, where I was in prison because of the Sharia law. So you don't have to be doing sex work, you don't have to do anything, just dressing as who I am. I can be arrested under the law and be placed in prison for 3, 6, and 7 states up to 1 year in prison for doing nothing. Okay? And that's the biggest problem. And like in states, especially states that have Sharia laws, like in Malaysia, we have dual system, so automatically it will detrade us from our rights as being a citizen in certain angle, especially when it comes to rights of your health. And as a result of that, violence, stigma, discrimination, and lack of access to healthcare, trans people suffers from the worst psychological and physical health outcomes than the general population. That's the reality. That is the reality, right? And prejudice and lack of training among healthcare professionals contribute to this problem at the same time, right? So what are the vulnerabilities? What are the health issues and so on, right? So when you talk about transgender vulnerabilities, family rejection, that's the first thing I mentioned, because I believe that without family support, trans people are open to such situation. For example, being placed, when you are so young and you want to start transition and your family reject you, you end up on the street. And when you end up on the street, you start to involve yourself in sex work, and then you become high risk, right? So that kind of, I would say, negative cycle continues because of the stigma, right? Domestic violence, bullying in school, lack of education, physical and sexual violence, again, employment, right, which is the main thing. Like in Malaysia, even though we don't have statistics, but I do have a drop-in center in Chowkit. Chowkit is a red light area. I would say 60 to 70% are involved in sex work. Why? Do you think trans people, our dream is to become a sex worker? No. Trans people just want to be like everyone in this room and out of the room too, okay? And then institutionalized stigma and discrimination. When we talk about health disparities, access to safe hormones, gender-affirming surgeries, HIV and sexually transmitted infections, mental health, which is very important, people don't talk about it, right? Substance use. Nowadays, back home in Malaysia, the issue of shabu, I can't pronounce the word. Ice. Oh, you mentioned, okay, so it's just ice over here too, okay? And it's so health setting that is not TG friendly, right? So, okay, I'm going to skip this. So again, when you talk about integration of gender affirming transgender healthcare programs. What is it? So when you talk about social gender affirmation, because we want to integrate, this is what I'm doing back home in Malaysia. I'm trying to integrate because I work closely with the Malaysian AIDS Council and also with the Minister of Health in Malaysia, Ministry of Health in Malaysia, whereby we work for transgender program, prevention program. So we try to integrate it by saying that when we talk about names being called, use the preferred name, preferred pronoun, he, she, right? And legal gender affirmation, we talk about legal change name, but that at the same time, that's about policies. And that's something that we need to really work out there. But something that we can work now, what we have right now, right? Psychological gender affirmation, felt gender respected and validated, receives internalized stigma and transphobia. And also we talk about medical gender affirmation, it's about pubertal blockers, hormone treatments, gender confirmation surgeries. So I'm going to skip this. This is something that I want to share with you guys also about experience in healthcare settings. Most transgender people, when you ask them, do you want to go to the hospital? They say no. Why? It's because of this. They'll be stared, they'll be alt, comments about their bodies, they'll be refused. We have doctors, nurses, and so on that refuse to touch them, touch sexual organs, which is unnecessarily, verbally insulted nurses and attendants, placed in the wrong wards. I know maybe this not. I do not know whether Thailand you have male and female ward, but in Malaysia you have. Okay, same in Malaysia we have male and female ward. So that's another big problem. Lack information regarding trans health and also misgendered. Right. This is some of the case that we work together with the Human Rights Watch. This is documented cases, right? So again, I mentioned earlier. Arena, she was placed in a male ward because of the male sex gender marker in the ID, despite her requesting to be placed in the female ward, right? Again, it comes back to your gender marker. Whether you've gone for your sex reassignment surgery or whatsoever, you still be treated as being male, right? And unprescribed hormones, right? Most transgender people who Suakam has interviewed, the Human Rights Watch have interviewed said that they take hormone to alter their physical appearance, and most of the time it's unprescribed. And where do they get the hormones from? Thailand. Okay. And case study, we have nurses who do not want to touch trans people, and even when you talk about the putting the blood pressure machine, the nurse didn't want to do it. She requested the trans person to do it herself. Why? I'm not sure. Maybe because she's so afraid that if she were to touch us, then she become a trans. So don't touch me, okay? So, and this is very common, misgendering. This is what I always do because I do sensitization with the healthcare providers back home in Malaysia. And I always say the first thing that you can actually capture the heart of a trans person is basically asking them, how can I address you? Trust me, they will melt. It's like, oh my God, she understands me or he understands me. It will basically create that kind of trust, right? So that is something we need to think about, right? And the impact of discrimination in hospitals or clinics is simple. They can't afford hospitals or clinics, right? Whether it's private, right? So where do they go? They don't go anywhere. Self-medication, and at the same time, it's a circle. And at the end of the day, when we talk about our rights to health, we are not being given, right? So this part is the WPATH Standard Care version 7. It's steps on how health providers should treat transgender patients. Show respect for transgender people or non-conforming clients, provide services, find out more. If you do not know about us, don't talk about us, but ask about us, right? And don't talk on behalf of us. What we want, what should we need. And this is something that people need to understand, that the community knows better on our issues, right? Provide the necessary services, get permission before giving treatment, suggest community support, be prepared to explain gender issues to family. And I just want to add in one thing, based on my experience. Do not be a doctor. Do not be a doctor to talk about your beliefs. And this is the problem which I always see. Example, I'm Muslim, therefore I'm sorry, I cannot treat you. I'm a Muslim too, right? So I have certain, I would say, certain health providers that has this mindset that, I do not agree you as being who you are, therefore I should not treat you. But again, isn't a doctor's duty is to provide healthcare for their patients? He did not mention male, female, or transgender. It's patients, simple. Okay, I'm gonna go. Just a quick one, I know. Tips for healthcare providers: listen and support your trans clients. Be professional and respectful, right? Know and respect human rights. Human rights, the best thing. Like, learn about your trans health needs. Now we are in the year 20. There's tons of information when it comes to trans health. Even in Thailand, I adore tangerine. We were like going to have a tangerine version of Malaysia because, everything is there. When I came to Tangerine Clinic, I was like, I couldn't speak. I was so excited, so happy because everything was provided from the nurses, from the treatments, from everything is there. And imagine if we have that kind of services, because I believe Tangerine is one of the best example of transgender health clinic that need to be continued. Yeah, have to be, right? So yes, yeah. But you guys still have your website there, right? Yeah, so do go to Tangerine website and you can find out more details about how to know about transgender health, right? And just a quick one, can I do this? Thank you. Yeah. So just a brief about what I do back home in Malaysia. So this is our Seed One Drop Center in Chao Kit. It's not a deja vu place, but it's still a safe place for the community. Yes, that's a real coincidence. Seed and our number is 69. Okay. Okay. And what we do there, we provide basic needs for the community. So in Malaysia, it's just not about the Twin Towers. We even have homeless people in Kuala Lumpur, and we have trans people who are homeless from the age of 15 to the age of 70 to 80 years old. And most of these transgender people are sex workers, and they end up on the streets and they get homeless. So we provide them that shelter, basic needs. They can come in for food, for hygiene, and also to rest, right? Yes, as I mentioned, for sleep, food. So in daily, we have like 15 to 30 people coming daily every day, right? And at the same time, we do sessions, we do talks, we do training, workshops, and events, not just with the community, but also with our stakeholders. We have sessions with the community, events held by, and if you notice, it's a mixture of cisgender women and transgender women, because wherever you go in a sex worker area, if you have a transgender sex worker, you have a transgender female. Sorry, I'm confused now. A transgender sex worker, you would have a female sex worker. So, they're always together, and there's no issue for them to be together, right? So we always, we are non-judgmental because our tagline is nobody gets left behind. So yes, and those, I always get transgender people coming to me asking me for jobs. And trust me, it's very difficult. It's very difficult for me to get them jobs. And if I can't get them jobs, we try to give them skills, like flower arrangement, makeup, and so on, so they can be out of the street, right? And this is something that I do, sensitizations. These are all the EU members in Malaysia. They came to our centers. They came to our center for introduction of what is the issue in Malaysia when it comes to the transgender issue, right? These are future doctors that came to our center, and yeah, and we do trans, and that's Mitch, by the way. Mitch is my colleague. He's a trans man. So SEED is a trans-led organization, right? And we do referrals to clinics, and we also provide CBT or community-based testing at our center. So the community can come in the center and do their testing at the same time. right? So this, and not just referrals to health issues, but also social welfare, legal issues, and anything that they need. Okay, and we also have the outreach and case worker program under the Global Fund and also the Ministry of Health Prevention program. So what we do, we provide safe sex kits, as I mentioned earlier on, CBT referrals and peer support, and yeah, so they give up safe sex kits to the sex workers and also, for their data and so on, right? This is a SEED transgender home. We also have the first ever SEED elderly transgender home located in different area. Our specific target is the senior trans woman, 50 above, and also emergency cases for any age. So we launched this actually 2 years back, and it's a space for the elderly woman, but at the same time, what we do there is that we also do our session in the home itself, and you can see the numbers of trans people coming in the center. Why? It's because they feel safe, they feel accepted, they feel that they can be there. And when we have our sessions, we don't say it's an HIV sessions, they will not come, trust me. But if you say it's a gathering for the community, it's a whatever thing that nothing related with HIV/AIDS, or it's a hormone session, they're gonna come, and trust me. And sometimes we have to take numbers. So yeah, as you can see, look at the numbers. Even our next session, if you look down, there's some doctors that came in. So we also brought doctors to come in the home and to meet the community at the home where they feel more safe, right? And basically, it's a place where they can be themselves, a place where they are accepted, loved, and cared for from all sectors, even from the health issues, and a place where they can call home. So yeah, you can see it's us that are celebrating those elderly trans that most of the time they don't have anyone. So we are the one that supports our family, right? Thank you.
Thank you very much, Nisha, for providing the very basic but it's very important principles for us as a healthcare providers that we need to know before we provide the healthcare services for transgender people. So I think I will give you a few minutes for the Q&A before we go for a break. I have been asked to give you 15-minute break at 2:30. So maybe, yeah. You have any question? Please raise your hand. Natalie?
Hi, for that wonderful talk. I have two questions for you. The first
Yes.
question is sex work legal in Malaysia?
Okay.
And the second question is, so I'm a pediatrician and I provide transgender healthcare to adolescents, and it's still quite new for us. Only around 25% of our population are transgender. So I just wondered what comments you had on how pediatricians can help to support transgender girls in their healthcare. Thanks.
Okay, thank you. So the first question is sex work legal in Malaysia? No, it's not. We still have the civil law under section 372B and 372A for soliciting. So most of the time it will be used against trans people. And that's why I forgot to mention, besides SEED, I'm also the co-founder of Justice for Sisters, where I'm working towards legalization of transgender women. So we are fighting those laws against trans people. So, but the second question was about adolescent. Yeah. When you say adolescent, so the age is for my personal experience, I would say, how can you assist them, right? I think the best thing is that that support, that peer support, because I always noticed that even when I was being young way back then, the thing that I didn't have was basically the information, the support system. And if you could actually bring that kind of support system in within, like the universities or schools, and in a way to say that, it is okay to be different, or it's okay to be transgender and so on, that would be awesome, because trust me, a lot of trans kids, they tend to feel alone. They tend to feel alone, and it's not a nice feeling. It's not a nice feeling. Yeah. Any more
Alright.
questions? Ask me
Any
anything.
more questions? Okay.
Thank you so much, Nisha, for that wonderful presentation. I just have one question.
Yep.
Talking about providing HIV primary healthcare or trans healthcare to the community, would there be any way, or in your opinion, how can the community member
Mhm.
themselves involve in this?
That's a very important question. Thank you. And I always believe community involvement is important, is crucial in any programs or projects that have been done, whether by the government or non-government. And it has to start from the beginning. The problem is, some people tend to feel I know better because I'm this position. So let's do this for them. It should be the opposite, ask us first and make sure you include trans people. And trust me when I say trans people can actually handle their own program. Trust me when I say that, because look at Mami Rina here, right? She speaks like a doctor, seriously. But yes, but at the same time, we need allies. We need allies that work together with us so that we can build community mobilization and also community strengthening. So I really, really encourage everyone to whatever project you do, think about us. Think about us. Yeah.
All right. Thank you very much, Nisha.
Thank
Please
you.
give her a round of applause. So, yeah, thank you, Nisha, for raising these issues. So actually, I forgot to introduce myself. I'm not a doctor. My name's Rina, and I'm a program manager for transgender health. I'm working at the Thai Red Cross Research Center at the Prevention Department, and I'm also overseeing the Tangerine Community Health Clinics. So it's a pleasure to be here. Bathroom or bring your break inside to the room, and we're going to continue to the next session. So our next speaker, we're very fortunate to have him here. He's one of the most popular doctors in the social media